Thank you so much. I'm excited to be here and also to talk about one of the things that I love to talk about and actually use clinically, motivational interviewing. And I'm also pretty comfortable with the subject, so I have some slides and I'm going to try to go through those and give you some more information on that, but I'm also open to questions. So please don't hesitate to raise your hand if something's not clear, or shout out, or just let me know if there's a particular topic or question you might have for me. So, sorry, I'm gonna, oh, here we go. Let's see if I can. Okay, I have no financial disclosures. I'm happy to consider any if anyone has them. And today, really today's objectives, I have them listed as helping you learn the spirit of motivational interviewing, which is probably my major agenda, because I feel like that's probably the most important part of using motivational interviewing. A lot of the strategies that we'll also talk about, the core communication skills, are things that you already are familiar with. It's just putting them in the context of that spirit, of that relationship. And then also, I guess more advanced, learning to identify change talk when you're hearing it. So really being on the lookout as you're having a conversation with a client or patient. When you hear something, how can I respond to that? What's like the next step that I can use? Is it an affirmation from here, or where do I go from here? And I think once we learn to listen for the change talk and actually pay attention to that with our patients, that gives them more impetus to like keep going, to motivate them, to help them find the motivation that they have to change their behavior. And then also recognizing client signs for readiness to change, and ways that we can pull that out and help to, in an am I consistent manner, help them plan for what's next in their behavior change. So you might, this is a great resource. I'll actually tell you, there's a couple things I've copied from this book, and I'll actually tell you, or like presented in slide form. It has wonderful resources in it, and I think it's overall a great representation of what MI can be in nutrition and counseling. And so I think it's not very expensive, but really worth the read, and has lots of great resources. So first, the spirit, or what is motivational interviewing. I'd love to see a show of hands. How many of you have heard of motivational interviewing? Great. Keep them up. How many of you have had more than, like, say, a CE credit in motivational interviewing? Okay. How many have had a whole class in motivational interviewing? This is fantastic. I love it. It's definitely growing in popularity and use, and so I love to see that more and more people are getting exposed to it. When I was introduced, I started in weight management with Dr. Wallace way back when we were both trainees, and we had a great influencer, a dietitian that worked with us, Bonnie Spear, who started my interest in motivational interviewing, because I had the, as a psychologist, I had the behavior plan down. Like, I could make a behavioral plan that would be, think of the triggers and the consequences and all the ins and outs, and I could make as a successful one as I could. But what I found is many of the families, the patients that I were working with, weren't really ready for that. Do you see that a lot in your practice? That you see people who might come, they might have some interest in changing, but when you really start to talk with them, getting to the work to actually get down and do what they need to do is tougher. How many of you see that? Is that something yeah. So motivational interviewing is really best used for people who are struggling in more the contemplative, pre-contemplative stage of change. They're kind of thinking about change, not really maybe ready for it. Where do you think we are as healthcare professionals? Where are we usually as far as that model of change goes. Did I hear someone try? Okay. Well, typically action. We're like the doers. We're ready to get it done, tell people what we can, offer our expertise, not be bossy necessarily, but offer our expertise and help people get where they need to get. But generally there's a gap, I guess is what I'm trying to say, that we are often motivated, ready to go, ready to make the behavioral plan, and we often see like a little bit of a gap there with the people that we're working with. Not always, but sometimes, and that's where motivational interviewing can really fit in. So the definition of motivational interviewing is a collaborative, goal-oriented style of communication with particular attention to the language of change. It's designed to strengthen personal motivation for and commitment to a specific goal by eliciting and exploring the person's own reasons for change within an atmosphere of acceptance and compassion. So I kind of underlined the pieces or bolded and highlighted the pieces that I think are most important in this definition. You know, one, it's collaborative. It's two people coming together to work together to make that change. It's also, I'm going to skip down a little bit, but it's also about a person's own reasons. And no matter how much training that you've had in motivational interviewing or how many classes that you've taken, if you go into a session with an individual, a patient, with an agenda, a specific idea of what you want them to do, you're not doing motivational interviewing. I'll go ahead and tell you. Because motivational interviewing is about that person's reasons to change and about the way they want to go about doing it. So we can, as experts, have great ideas about what works. So just throwing out weight management stuff when I was there, I know that 0-calorie beverages are a great idea. I know that like increased activity, joining a gym, walking around my neighborhood, I know that eating more fruits and vegetables. I know the 5-2-1-0, right? I can think of all those things that are going to be helpful. But the things that will be helpful to the patient are what they think of. Now you can offer ideas. So you can, with their permission, offer ideas as an expert. And that's important to identify yourself as an expert. But really not try to manipulate or force or push any agenda that you have onto a person. So I think that's really huge to consider. And that's one reason why I'm just going to pick on Dr. Wallace, but she says, can I do motivational interviewing with my teenager? And I'm like, no, you have an agenda. You can't do it. you have something in this game, so obviously, we all, as healthcare providers, have something in the game when it comes to our patients or clients if we value what we do. And actually, that's one criticism of the use of motivational interviewing in healthcare. But I think that many of us can understand that an individual comes to us with something that they might want to change, and we can be of assistance in a way that's collaborative, a way that focuses on their reasons, and sees them as a person, a human, with strengths and weaknesses, trying to focus on the strengths, but coming to this table, not somebody with lots of weaknesses that we got to fix up. So motivational interviewing is really more about meeting a human where they are, helping them to get to maybe a different place where they want to be, and doing it on their terms by offering some advice, suggestion, expertise as we move forward. So these are my pet peeves. So some people will say, oh, it's just a way of being nice. Well, you know what? I love motivational interviewing. I love MI because it's warm and fuzzy. And I'm warm and fuzzy, and I love warm and fuzzy, but it's not just a way of being nice to people. It's more than that. It's also not arguing with someone about change. You have to change. But my uncle smoked 10 packs of cigarettes a week, and he never died of a heart attack. So it's not that back and forth, like, let me show you the data. I love data. I love research. I form my ideas, my expert knowledge that I share with anybody that I work with. But it's not about pressing that on someone else. Maybe informing them with their permission, bringing it into the context or the space we're at if it makes sense. Maybe even not calling it data. In fact, with adolescents, I learned pretty quickly that I couldn't say, well, research says that, because some of them do care, which is kind of cool and exciting when that happens, but most of them don't care. But if I say, some people that I know that are teens have tried this out and it's worked for them, then that could be useful. They might relate to that. So it's also not direct advice or solutions, again, without permission or without the encouragement of choice. Like one phrase that if you do motivational interviewing regularly, one phrase to really get used to is, what you do is entirely up to you. It's your choice what changes you decide to make. Those are pretty common. Like, it's really your choice. And I don't know about you, but this is another piece that makes me like MI, is that I like that, because you know what? I take on a lot of responsibility for being a good provider, a good health care provider. I definitely don't want to be like Jillian Michaels and running up to someone's door and checking on them and taking responsibility. Did you do those exercises I told you? Did you think positive today? So it is their choice. It's their decision how they use the information that we give to them. It's not the use of an authoritative stance where someone's passively kind of listening. It's not a lot of talking like I'm doing now. It's really like back and forth talking and really getting to know them. Understanding also we're in I'll give you some tips on that we are in settings where we have to be pretty quick with what we do, and there are ways to do MI and accomplish that. And it's also not labeling someone with a problem or using punitive speech or tricking someone into the change. So I always tell trainees, you have to use your MI powers for good, because there are ways that you can talk someone into something, right? I mean, you probably can think of a time when you really wanted something and you talked someone into something, maybe not with a patient, maybe with a family member or friend. And so the same is true here. And so you have to be careful and really take a step back and say, is this about me, or is this something that they're really invested in and want to learn more about? So again, just to review, it's patient-centered, it's gentle guidance, it is focused, it recognizes the patient's autonomy, their own ability to make decisions, and it's collaborative. It's an atmosphere that's conducive to change. One of the things I hear quite frequently as a psychologist is they weren't listening to me. They didn't hear what I had to say. Like in MI, I feel like that's really part of MI. You're really trying to listen. You're really trying to hear what they're saying. You're not just giving, just the same advice. We had Dr. Wallace is getting picked on a lot today. I won't name names. I don't even remember the name, but we had a certain provider way back when. This was many years ago, and this provider is probably not even practicing at this point, but always prescribe swimming. Swimming's awesome. Love swimming. It's definitely an activity. It's going to be useful. But you know what? Not everybody likes swimming, and not everybody has a pool to swim in. So there was just a little bit of a gap there between, what's possible, and also just thinking about, again, collaborating with the patient and finding what works for them. Being strength-based and focused on goals and values. Also understanding that, this is a question I ask all my patients, but I'll go ahead and ask you all. Who are you in charge of? Yourself, right. So you can influence anyone that you work with, but you're definitely not in control of them. And I think that's important to remember too, that I can have a positive influence, I can like what I do, I can appreciate what good counseling can do, and I can provide good counseling, but ultimately it's up to the patient. So it can be influenced by us, by our interactions, but ultimately it's the person's decision to make the change. This is a picture of my daughter. It was her first dance class, and at a great space, but I had to be behind a one-way mirror. I couldn't go in with her, so I was just observing. And obviously the picture on the left is her before the class. She's pretty anxious. She's never been separated from me. She doesn't quite understand why I have to be behind the mirror. She doesn't know about this dance thing. And then, of course, the picture on the right is her after class, where she's totally excited. It was a fun time. She gave it a try, and it turned out much better than probably what she was expecting. And this is what I hope for all of the people that I work with that are considering behavior change when I use MI, is I'm hoping they're going to get from that contemplation place that's kind of icky and difficult and get to completion, where they can look back and say, I did this, I accomplished this, and I can say, yes, you did. You really did do what you wanted. I love memes, so you'll probably see a few more. Another part of the spirit of MI is if an egg is broken by an outside force, life ends. If broken by an inside force, life begins. So great things always begin from the inside. You might think back to maybe like a favorite supervisor or teacher, or maybe figure who really influenced your life. And if that was a really positive experience, it's probably true that person didn't tell you what to do. You need to go out and you need to do this, this, and this. It's probably more true that they listened to you, maybe gave you some suggestions, but sort of let you take charge, didn't micromanage you, force you to do things maybe that you weren't ready for, but let you be independent and try things out and feel successful. And so I think the same is true with MI. Evidence, I won't spend too much time, but it's important to me. The evidence for it is really good for adults, and I would say that it's developing with adolescents, meaning that there's some good studies out there, but we're not where we are with the adult literature, and there needs to be more research, which is something that I'm interested in as well. So we know that there's been a systematic review and meta-analysis with 119 studies where 75% of patients improved, 50% made small but meaningful changes, and 25% made more moderate to large changes. The other pieces of MI that are important in research is to know that MI produced comparable effects to other interventions, but in less time. And stronger effects were noted when it was coupled with individualized relevant feedback. More treatment means better outcomes, so there's sort of a dose-effect response with MI. And effects maintained at 3, 12, 24 months, so they're basically lasting, which is nice to see. And it's similar across age, gender, and ethnicity, so it's not constrained to just only one type of person or individual. We know that it can be quick, and often you can do a short MI piece of what you're doing in 2 to 3 minutes, or by adding 2 to 3 minutes of what you're doing, of MI to what you're doing. It increases engagement, retention, and adherence, generates less resistance, and may, again, work best with more difficult cases. People who are ready for change don't necessarily need MI. You might run into those folks intermittently and, ready to go, ready for that behavioral plan. If so, go ahead and try that. Often what I see, though, is that even if someone presents in that way, sometimes that changes throughout the time that we work together. So MI is still a good counseling strategy to have when you need it. These are the 4 processes of MI. I'm going to stop and say, after I explain them, kind of why I think it's helpful to think about MI for use with nutrition. The processes are engaging, so sort of the question is, shall we work together? And then focusing, what is it that we want to change? And then evoking, why should I make this change? And then planning, how do I just go about, what's the steps here? So getting closer to the behavioral plan. For nutrition, I think a couple important things to remember. lots of nutrition is about behavior change, and we know MI works well with behavior changes. The other thing I'll get asked sometimes is about disordered eating, so things like bulimia or anorexia. How does MI work with that? I would say certainly there are evidence-based treatments out there that are important to have as a part of what you're doing. MI might be a lead-in to those, like it gets attached to other therapies, to help the person become ready to then move forward. For example, with family-based therapy, you might do MI with somebody, or before cognitive behavioral therapy. I also neglected to mention that MI originated with substance use disorders, and so the link to it being useful for bulimia and anorexia is also present. Why might you think that? When I say that history of it being linked with substance use disorders might make it helpful for those? Any ideas? You guys are quiet. I should have brought some candy. Like, toss it out. Okay, so with many things that MI is trying to change, there are usually things about it that people like benefit from, maybe not enjoy. There might be pros and cons of certain behaviors. So what do you think the pros might be of restricting or of anorexic behavior for someone who's using that? Come on, you guys are dietitians, right? Okay. They feel like they have more control. Great. And I saw another hand. Any other?
I was going to say control as well.
Control, okay. Control, maybe even to extend it a little bit further, when somebody restricts calories, they might have like an agenda in mind. Like they might originally start with wanting to lose weight, right? And then they start restricting, and then they see the success of that. And so restricting sometimes is reinforcing, because maybe their body image might be skewed, or they might be aiming for something. I so enjoyed the last presentation. They might be aiming for something that's less realistic, right? And so restricting can serve sort of a function for a person, a more positive function for a person than we might think. So really, MI can be used to think about what are the things that we're getting out of this behavior, what are the things why would we want to change it then? And then kind of go to the other side. Well, it's not healthy, right? It's putting my health in danger, or there are consequences of this behavior that I have. Somebody who binges and purges might think, well, I can still eat the foods that I want to eat. I get to enjoy all those tasty foods, and then I don't have to absorb the calories. Well, that might be a positive thing. So always, with motivational interviewing, we're always thinking about what is it that might be a motivating factor in the behavior, what's pushing it, and what might be something a reason for change, right? So engaging, when we think about engaging, we think about the basic communication skills. And many of these are probably what you all are already familiar with or have learned about in graduate school or in your training. Those are the ORs. Well, I use ORs. There's lots of other ones out there. But open-ended questions, affirmations, reflective listening, and summaries. And so with open-ended questions, we're basically asking questions that have a wide variety of responses. So instead of something like, what did you eat on Saturday? An open-ended question might be, tell me about your typical eating patterns on the weekend. So you get a lot more variety of responses from an open-ended question than you might from a close-ended. Also, if you ask several close-ended questions one after the other, it feels more like an interrogation. Close-ended questions are okay, and there are probably certain times where those are valuable and needed, and there might even be structures where you ask more close-ended questions based on your discipline. It's okay, but really what you want to try to do is ask more open-ended than close-ended. when working in weight management, I get used to asking the open-ended question of what other types of eating do you find yourself doing that you think might be a little unusual or different than other people? And it was amazing what people shared with me, the things that I would get that I don't think I would have gotten if I asked like a close-ended question or a more narrow question. So picking questions that are going to have the person do most of the talking so you can absorb and understand and listen, and then move forward from there. Here are examples of starters. So how often, to what extent, closed or more did you, will you, can you. If you ask a close, this might be a good next step for the people who want to get better at motivational interviewing. You can do it if you want. You're totally in charge of what you decide to do when you leave today. But if you find yourself asking a closed-ended question and realizing that you got yourself stuck and didn't get the information you were hoping for, see if you can change it right then and there into an open question. Because it's okay to ask something similar again, but in a different way, and it'll be interesting, enlightening to see how that would change, and good practice too. So here are some examples of open-ended questions. Tell me about what you eat in a typical day. What do you hope to get out of this appointment? What makes you think it might be time for a change? How do you see this affecting your performance on the field? This diagnosis must have been a shock. How are you dealing with it? What possible long-term consequences of diabetes concern you the most? So probably when I start out doing MI with a patient, I'm going to ask them something more similar to tell me about what you eat in a typical day, right? I'd probably have to know the person pretty well or have established some really good rapport to ask some of the questions toward the bottom. I think it's also important to see that sometimes questions are more intrinsically more MI focused. So for example, what makes you think it might be time for a change? Is really asking the person, why now? Why are you going to make the change now? What is it about now that makes you, prepared, ready to move forward? So that question it's got a little bit more oomph, a little bit more help as far as improving the motivation of someone to move forward with their ideas of change. The next one is affirmations, and I come from praise, like pediatric psychologists, child psychologists that's like one of our superpowers probably, so I love praise. But praise is different from affirmations, so make sure that you take that away today. It took me a while to put that together. Praise is like, great job, high five, thumbs up. An affirmation is more like, wow, you really set that deadline to get started and you did it. You made the changes you wanted to make. Affirmation of strength, ability, good intention, effort, the things that get us to where we want to be, the things that help with behavior change. And so try to focus on that. It's really lovely to see someone you're working with respond to that. Like you know that when you're ready, you're going to make this happen. And when you have someone sitting across from you saying, yeah, that's right. Hopefully it translates into action, but it's really rewarding. And I think probably many people we work with don't come from a tradition of getting affirmed for what they're doing. And I love the meme earlier about, I forget the exact wording, but we don't get very far when we're punishing ourselves, right? Or it's really more about affirming ourselves and moving forward in that way. They need to be sincere, so try to be careful about that. Teens will call you out. They know. And also, it generally increases someone's belief in their ability. So if you're affirming something that they've done or saying they're going to do, generally speaking, it's going to just accentuate that and help them feel more empowered. And it also it's a chance to give information about what works. So affirming, if 0-calorie beverages is one of those things, evidence-based works, you can say to them, wow, you're really ready to make some changes and you really think you're ready to go with this 0-calorie beverage idea? Are you really ready to go with more fruits and vegetables? It's awesome that you're thinking about what really works for you, so you can affirm things that you know to be true, which gets into that sticky situation of not to be manipulative, right? But use your expertise, your powers for good, and then deposit into the rapport bank, just meaning that you're working with them to build that rapport, to help them feel confident, to understand that they can move forward. And then when you make the behavioral plan, they're going to work that out with you. So here are some affirmations. So you've had some success in the past. Anytime somebody's had success, whoa, perfect chance for an affirmation. Taking care of yourself in this way is an important step in the right direction. Regularly taking your medicine helps you manage your health. It's great that you're figuring out what works for you. And your family is most important to you, and you can see how making this change will really create trusting and positive relationships. So these are all ways of affirming. So here's some affirmation. Putting on pants today, yes. Reflections are basically, there's two kinds, simple and complex. So simple are just saying what they said. Complex adds some substantial meaning, or even guess at some substantial meaning or emotion that goes along with it. In general, new research in the area of motivational interviewing says you really want to aim for about 3 reflections for every question. So you want more open-ended questions than close-ended, and you want more reflections than questions. And that's really more similar to an MI style that works. Although I don't think about those numbers when I'm doing it, I do think practicing using more reflections is important. So that's another strategy you can put down as a possible choice you can make if you want when you go and leave here today. So complex, simple would be someone saying, I really don't know what I want to do about it, and you would reflect, you're just not sure what you want to do. A complex reflection would be something maybe more like taking from what you've already talked to them about, not putting things in there that you haven't talked about, but or assessed based on how they're presenting to you. You're feeling on the fence about this change. You can see how it'll help you in the long run, but it also feels like a lot of work. You're also already stressed and having a hard time fitting in all that you need to do day to day. So reflective listening phrases, sounds like it's difficult, easy, you realize that. So these are some good ones to have around. I kind of use the same ones over and over, so I have to remind myself there's more out there. And then feelings vocabulary, this is probably one of the main reasons that if you're an RD or you have your own practice and maybe there isn't psychology available, you need to make friends with someone that's a counselor or psychologist, because there's a lot of feelings in food. I know you guys know that. That's not new news for you, and food patterns with families and patients. And so it's good to have somebody, maybe a couple people that can be on your call list. When you have someone that needs some services, you can get them where they need to be. So it's okay to guess, again, based on the information you're seeing, how they look, how they're responding to you, things they've said. You don't have to hit the home run. They're going to tell you if it's wrong. And then summaries, these are the ones that are the time savers that I mentioned. I was going to give you some tricks. So sometimes we'll have a patient that comes in and they have lots and lots and lots to talk about, maybe many things that they're thinking about changing. You can use a summary to say, okay, wait a second, let me get this clear. This happened, and this happened, and you're thinking about changing this, but you've also thought about changing that, and do I have everything clear? And then so you can sort of stop things and then maybe offer them, you mentioned these 3 things, and just what you said, is there one of those things in particular that matters most to you to talk about or work on? Again, getting that collaboration going, getting them involved. So summaries can help with your understanding, and they also can help you focus, which is our next step. So the first thing to do is to announce it, invite them to correct you. Again, think of that collaboration and recognize that they could still be pretty ambivalent. That's okay. All of us can be pretty ambivalent. So here's a really long summary, but let me stop and summarize what we have just talked about. Make sure to correct me if I don't have something right. You're not sure that you really want to be here today, and you really only came because your mom insisted. At the same time, you do feel like your weight gets in your way, and you definitely don't want to get diabetes like your grandmother. It also upsets you that many of the trendy clothes you want to wear don't come in your size. Is that right? So that's an example of a summary that you might be able to do with a teen, and then see where you go from there. So focusing, getting their feedback. Yeah, let's talk about that, because I want to talk about my weight. I want to make some changes. Here's another favorite meme. Change is hard, right? So again, ambivalence can be part of the picture still. It's difficult to think about making changes, and there might be some things that are a benefit of the behaviors that they're thinking about change that are hard to give up. Maybe you have to find a different way to get that benefit. So I always like to ask, it's helpful for us to think, maybe just sit and think for yourselves, how many of you have had a behavior change that you thought would be good for you, that you thought would be healthy, an improvement for you, but then maybe went to see a doctor about it and didn't tell the whole truth. Maybe even told them, information that wasn't quite accurate. I always like to use flossing. How many of you tell your dentist that you floss every day or agree? Yes, I do that. Yeah, but how many of us really do that? Some of us might, but how many of us really get every day in, every single day? So you can kind of see where I'm going. Why do you think, first of all, know that the people that you're working with might not tell you the whole truth. Your patients might not give you the whole truth. Why do you think that is? What are some reasons why we don't tell our doctors the whole truth? Don't listen, Dr. Wallace.
Because he knows. I'm sorry.
I'm just embarrassed.
Embarrassed, maybe.
I was going to say, we know what we should be doing, but that doesn't always correlate to behavior.
We know we should be doing it, but maybe we're not. We know that. Do we want somebody to know that too? Do we really want them to know we're not doing what we know we're supposed to be doing?
I think sometimes you don't want the lecture that follows admitting that you.
Yes, you don't want the lecture. Yeah. How many times have you had the lecture about flossing? Yeah, I got that one, I think last visit. I think I keep getting the education about flossing. I really do floss, not every day, but last time it was about hugging my teeth, and I'm just like, oh, but I floss most days, So you're right. We might not be ready. We might not want to change. It might be hard or embarrassing to share that we're not doing. We don't want to be lectured. There might be some things that we enjoy about our bad habits. So sometimes it's difficult to share then too. So another fun meme that is kind of related. As clinicians, again with change, sometimes we can focus on barriers, and that leads to frustration, so I call it, I think this was maybe a Saturday Night Live, or I could be making that up, but Debbie Downer, was that a character on Saturday? Okay, so it's sort of like the Debbie Downer experience. It's hard to change. Yeah, you're reflecting, oh, it's so difficult, and you tried this time too, and then this got in the way, and so that's an example, I think, of what sometimes happens when we're trying to do MI. But one of the things to remember with MI is we're really it's good to have empathy and to say those kinds of things maybe once or twice, but during the session what we really want to do is move forward. So you can get in this sort of cycle where you're on the hamster wheel of it's so hard, change is hard, what you talked about, that was a hard goal, maybe we need a different goal, let's get off the wheel and let's say, you tried, that's super important, you really put an effort in. how do you think we can change, how do you think you can change things this next time to make a difference in what you want for yourself? What do you take away from what you tried? What was successful, maybe? So really trying to focus on the positives. Because our patients sometimes will get stuck, and part of our job is to help them pull out from that. This is a quote from one of the individuals who works with MI, and MI is with someone is like entering their home. One should enter with respect, interest, and kindness, and affirm what is good, and refrain from providing unsolicited advice and rearranging their furniture. So that's a good thing to think about when you're working with someone and trying to do MI. Okay, here's where I'm going to give you a few ideas of how you can provide MI, or tricks that you can use with MI to help with focusing. So one of them is to get the patient's agenda. So we've talked about, or after I've reviewed the forms that you've completed in an intake, here are the things that I see that you've checked that might be things we could talk about. So you can offer a menu. Here are common things that I talk about with many of my patients, like this, this, and this, and this. What interests you? One of my favorite things is using a circle chart. And this comes out of the book I showed you earlier. So you can put those things down that you commonly talk about with people that you see, and you can leave a few empty spaces, and you can pull it out on a sheet of paper or even like a laminate and say, you know, we could talk about eating more regularly throughout the day. We can talk about choosing satisfying, balanced meals while eating out. We could talk about planning satisfying, balanced meals at home, being more mindful while eating, beverages, tuning into hunger and fullness, or something else that might be more important to you. So you can actually have some things ready available for them to choose from. I like this idea because sometimes, even though someone wants to change, they don't recognize some of the ideas or areas that they could talk to you about that would be really helpful. And so this could stimulate that and help them get involved in picking something that's important to them, or picking something entirely not on here that's important to them. And then with evoking is going back to listening for the change talk, and then listening for it and then drawing it out. And so in order to do that, we use something called Darn Cat. And this graph I also got, we think that behavior change looks similar to this, that we have desire, ability, reasons, needs, then we move on to commitment and taking steps, and then behavior change actually happens after that. So this chart is something, sorry, I'm going to skip forward. It's something I got from that book as well, that I think really helps kind of cue you in what to listen for, the types of talk to listen for, and also what that might mean and how you can move forward. So if a client says something like, I don't want to end up like my uncle who had a heart attack, that's a desire, that's a wish for them. And so that would be a great point of, saying you really want to do things differently. You don't want to have the same experience that your uncle had. Like that would be something where I would use a reflection or a complex reflection. I've cut down on soda before, so I know I can do it again. Same thing, it's ability. You have done it. You've been successful in the past when you've decided to cut down on your soda, and you've done it. And this might be something you could think about for the future. You know, once again, just helping pull or move with them forward. I hate the fact that gym makes money off me because I never go. You really don't want that gym to make that money because you're not going. You really want to make a different decision about what to do. You know, you don't necessarily have to tell them specifically what it is, but you help them along. You're trying to figure out how to fix this. I really need to cut back on the amount of caffeine I drink. I think it's affecting my sleep at night. that's, you really need to do this. This is for your health, and you're thinking this is really going to benefit you. Then when you get to mobilizing change talk, which is more the commitment, activation, taking steps, these are where I think the affirmations come in. I'm going to start training with my girlfriend for a 10K. Like, you've really decided that training with your girlfriend for a 10K is a way to make this change, and you're ready to do this. So you're meeting them where they're at and helping them continue and build that motivation. Okay, so these are some questions you can ask to pull darn out. So if you're really listening for change and you feel like you're not change talk and you feel like you're not hearing anything, you could say something like, how might you want to change your eating? How would you go about making these changes? What are your reasons for making these changes? How important is it for you? So you can ask questions that specifically pull that information out, and that can be useful as well. The other piece to remember is to think about roles and values. So a parent might say, I'm actually thinking of a video that I sometimes show, and you all may have seen it before, but it's about a pediatrician talking about BMI with a patient and explaining why being overweight at this age is a health risk and how to make that change with the mother. And the mother says, well, I don't do sodas. We don't do sodas at home. We do lemonade, and so you might say, oh, lemonade's, sugar, right? It's not much better than soda. But, one thing, in a twist, one thing you could do is say, well, I can see that as a parent, you're really concerned about your child's health, and you're trying to make decisions that's going to help improve their health. You don't say, lemonade's a great choice, right? But if you say it in a way of like, you value being a mom, you value feeding your child healthy foods, like these are your values, that's something that can help also with motivation, because that's going to be probably, if you were to ask that mom, what are the reasons you might want to change eating styles at your home, it might be for my child's health. It might not even be for her health. It might be for the child. So thinking about motivation from the aspect of what are the person's values, where are they coming from, what's important to them, or asking them if you're not sure. Importance and confidence are also important in motivational interviewing. We have these rulers that we talk about, readiness rulers. So the two things that you can sometimes assess where your patients are at and where they might go after leaving your session is asking them, how important is this change to you, from 0 to 10? And they might say it's an 8. 8 is awesome. Why isn't it an 8 and not like a 5 or a 6? And get some ideas of the strengths that are building them up to that. You could also ask about barriers. What would get you to a 10? To see what's maybe been getting in the way, or goals that they might have that they're thinking of. But the other really important question to ask is, if you ask about importance, you also need to ask about confidence. Because sometimes a change can be really important, but someone can have like 0 confidence about it. We would see this a lot in weight management, because we often had patients that had been trying for a long, long time, as you all probably do as well. And maybe they're thinking like, it's just not going to happen for me. So asking about confidence is important, and then talking about maybe ways to address that to help them move along with their goals. The other thing to do is think about expressing empathy and coming alongside. This is especially important when somebody feels stuck. I understand that you feel angry when your parents grounded you for smoking. I get it. How do you think they should react? What would you want them to do? Or just, stopping there. I get you don't want to talk to me, you don't want me to bug you about your smoking too, right? Because you're probably being bugged by everybody else. But empathizing, coming alongside, while we have this time together, why don't we take just a few minutes, or can I ask you 3 or 4 questions about it. Is that okay? And that might give you the opportunity to move on with someone who's a little bit more maybe not ready, pre-contemplative, not really wanting to be there. And if they say no, they say no, but you tried. Okay. Developing discrepancy, I'm going to say, is a little complex, and I'm just going to say that you have to be really careful about this, because even if you say it, you have to use the most neutral voice or expression possible, and I probably wouldn't do it with a new person who doesn't know me that well. So what are your future basketball goals? How do you see smoking fitting in with these ambitions? Do you see how it could easily be interpreted as, how do you see smoking fitting in, right? Like, you have to be really careful with that discrepancy. It has to be very neutral, because it can easily be misinterpreted as you sort of poking, right? So I would, probably encourage you to use other means, but it's okay to do this if you can do it in a very neutral way, and work on moving forward, like how this can help them move forward. So here's a discrepancy. Emphasize personal choice, kind of one of the first things I said. What you decide is really up to you. And then pros and cons are another way of looking at it, which we talked briefly about earlier. Like, what are you getting out of it? What are the pros? What are the cons? What are the pros and cons about changing? And then rolling with resistance. Many times, if you start having a person say, yes, but, like you're saying, can I offer you some suggestions? And you go through them, and it's, oh, but I can't do that because, and yeah, that's a great idea, but that's not going to work either. I think that at that point, kind of taking a step back and going back to exploring with them, asking more open-ended questions, maybe even saying, it sounds like you've thought about a lot of things and have come up against a lot of barriers. What's a possible solution? Can you think of any? Maybe not, but that's something you can ask too. And also being sure to ask permission to offer advice or suggestions, making sure they're on board with you, they're talking to you. Okay, then planning the bridge to change. So we want to get commitment, we want to develop a plan, we want to limit prescription, but don't be insufficient with direction. So you want to give them some ideas too. My favorite slide is more this one. So if it's, say eating, what do you want to do? We've talked about a lot of stuff today. What do you want to do about your eating moving forward? If you feel like they're going to have some ideas, if it seems like they're not ready, you can say, it sees that you're not really ready to make a change at this time. Would it be okay if we met like in a week or two to talk about this again? Hopefully you've done some excellent MI build-up engaging skills, so they're going to want to come back, because that's what the research says, is they're good at coming back. And then if they're kind of ambivalent, which also I think would be pretty typical, then you can say, can I share some strategies that have worked for other families or patients that I've worked with? And you give them your amazing strategies and see if there's one that they might want to try out. You can ask, what do you think might work best for you? Which of these might you be willing to try? Where does that leave us? You sort of give that, put that in their hands. Or where would you like to go from here? And so if they're ready to change, then you just affirm. It sounds like you have some pretty good reasons. What do you make of all this? And how do we need to check back? So that's pretty much my fast-paced hour-long MI. Do you guys have any questions for me at all? Okay. Well, I'm happy to answer any if you want to reach out to me. I think my email is on the slides, but it's haustin@peds.uab.edu, and feel free to reach out at any time. Okay, thank you.